Yes, welcome students to my channel. This is the first lecture in physiotherapy, medical and surgical condition, and it is a very important topic, that is burns. So when you hear a term burn, yes, it always comes into our mind. The first picture which comes into our mind is fire, or if I talk it in a Hindi, it would be aag. So the first thing which always comes in our mind when you hear it about burns, it is fire. And the second thing which comes is skin. So we all know that if there is a burn, the burn is going to damage the skin. Yes. The skin, which is the largest organ in our body, yes, the skin, which is the largest organ in our body, is predetermined, particularly damaged because of burns. The burns can be of various degrees, yes, and various types. Certain books term it as first degree burns, second degree burns, third degree burns. Some books term it as superficial burns, deep burns, subdermal burns. But if you talk in terms of medical knowledge, burn always is not just because of fire. The burns can be because of certain chemicals, can be because of certain irradiations, yes, can be because of electricity, yes, and can be because of inhalation of certain toxics. So basically in this lecture we are going to focus on thermal burns and electrical burns, and how these thermal burns are classified based on the levels of their injuries and the skin level which they affect, and electrical burns. What is the burn wound zone known as? Also, how to assess a burn and what are the common burn deformities. Yes, so these are the topics which will be covered subsequently in the burns lectures. The today's lecture, that is lecture number 1, is basically focusing on classifying the thermal burns and defining and understanding the particular features of those thermal burns. Okay, so we would move ahead with this. So definition and epidemiology is very much important. The reference to this is Suzine Sullivan physical rehabilitation book. So what is burn? Burn is nothing but loss of skin with the impairment of skin function. This means damage to the skin with impairments. Impairments means problems in skin. This is what your burn says. In US, 1 million burns per year. Yes, so that is somewhere around 4,500 to 5,000 deaths occur per year. This ratio is much more higher in India. Why? Because we still use gas, we still use premises and household appliances. There are acid attacks, the electrical fire question remains a worrying question in India, and number of population. So all these reasons, the number in India is much more higher compared to uh, in US. In children, it is more common in 1 to 5 years, and more it is because of hot water burns. Yes, in India. In adolescent, it is somewhere around 16 to 14 years, 40 years. So this is an epidemiological thing, which is as such not major, which is not going to make major difference in the theoretical part. Uh, Also, there are various data which shows the levels of burns and the problems associated with burns in India, which may discuss later on. So this is the most important part from this slide is the loss of skin with the impairment of skin function. Loss of skin with the impairment of skin function, that is known as burn. Please make sure that we are aware about it. Okay. So now before we move on towards another thing, I would like to say, I would like to draw the layer of the skin. So now we all know that we have two layers in the skin. Yes, I would just have a brief and short classification. The uppermost layer is known as epidermis. Yes, the superficial layer, and the second layer is nothing but your dermis. The dermis is further divided into papillary dermis and reticular dermis. We'll see it in next slides. But as of now, yes, what is important is layers of the skin. This diagram is much more important. So I would like to label it out. Epidermis is the superficial layer, and the dermis is the deep layer of the skin. Superficial layer, yes, of the skin, and second one is the deep layer of the skin. Yes, so this is the basic layer of the skin. Now we would move ahead with our slide presentation. Yes. So the epidermis, which is the outermost layer of the skin, has three parts: stratum cornea, stratum granulosum, and stratum spinosum. The basic function of the skin is to protect the body from the outer damage or from the environment. So epidermis, which is the outermost layer of the skin, yes, is having three basic structures: stratum corneum, stratum granulosum, and stratum spinosum. And the dermis is having papillary dermis and reticular dermis. So I would again go to our whiteboard slide for an easy classification, understanding classification. Yes. So this epidermis is divided into stratum corneum, stratum granulosum, and stratum spinosum. Stratum granulosum, stratum cornea, granulosum, and stratum spinosum. Okay. Yes. This dermis is then this dermis is then uh, having our papillary dermis and reticular dermis. Okay, so dermis is then having papillary dermis and reticular dermis. Okay, so we are now going to focus on human skin diagram. Stratum corneum is the first layer, granular is the second layer, and spinosum is the third layer. Sebaceous gland, erector pili muscles, sweat gland, nerves, hair follicles, and collagen and elastin fibers, all these comes under your dermis. After that, you can see we have different arteries and veins. So this is known as subcutaneous tissue or subdermal layer. So again, I would like to go to our whiteboard slide. Yes, where it is mentioned. As I said, in dermis, we have again two parts, reticular dermis and papillary dermis. Okay, the layer below this is known as subdermal region, subdermal layer or hypodermal layer. Clear? So we are now focusing on the skin, which is having epidermis as the outermost layer, dermis, which is deep layer, and then the subcutaneous tissue. So I hope everybody has understood this classification. Okay. Now, moving ahead with this, there are different structures, sensory structures in the skins which may be affected, based on the level or location which has been involved. So free nerve endings, yes, free nerve endings are affected. When are free nerve endings affected? When there is epidermis involved. Merkel disc is affected when there is stratum spinosum. Free nerve endings, dermis. So we all know free nerve endings is related to pain. Merkel's disc is related to touch. Yes. So in the case where stratum spinosum is involved, the touch sensations are affected. In the case where is dermis involved, pain is affected. Mucinous corpuscle, again papillary dermis and reticular dermis. So these are all your structures, sensory structure. So based on those, we have this structures which are being involved. Clear about this? So this is the direct table from Susan Sullivan physical rehabilitation book. Free nerve endings, epidermis, Merkel's disc, again stratum spinosum, free nerve endings. So for example, if any burn is there, which is affecting the dermis, this means free nerve endings, Merkel disc, and again free nerve endings are being affected. Clear? So pain, touch sensations are being affected. Okay. So based on the structures, sensory structures which are being involved, uh, we can assume that if the epidermis is involved in the burn, we have free nerve endings which will be damaged, which will lead to pain or itching sensation, decrease in pain or itching sensation. So based on the structures which are involved in the papillary, either it is papillary dermis or reticular dermis. Okay, so if the reticular dermis is involved, we have Vaccinian corpuscles, pressure and vibration sensors affected. Clear? So moving ahead with this, as I said, the burns are typically classified under thermal categories, chemical categories, electrical, friction, and radiations. We would be much more focusing on types of thermal burns. Yes, thermal burns and electrical burns. Okay, so in this lecture we will be having a clear view about how a thermal burn is classified based on the levels involved. Okay, yes. So thermal burns are classified like superficial burns, superficial partial thickness burns, deep partial thickness burns, full thickness burns, and subdermal burns. So again on the whiteboard, yes. Okay, so we have thermal burns classification. First one is superficial burns. Second one is superficial partial thickness burns. Third one is deep partial thickness burns. Fourth one is full thickness burns. And fifth one is your subdermal. We all have a basic idea about this. Superficial means epidermis is involved. Superficial partial thickness means epidermis and part of dermis is involved. Deep partial thickness means epidermis and whole dermis is involved. Full thickness means till the subdermis region, and the subdermal means below subdermal. Okay, so this is what a super brief classification is. Now moving on towards the classification in detail. Yes, superficial burns. Okay, so now as I had drawn, yes, so for example this is our skin. So we had divided the skin layer into like this regions. Clear? So here this one is epidermis, yes, and this layer is your dermis. So in this superficial burns, whole, I'll denote it with yellow color. These are known as epidermal burns. Clear? So this is the region which is involved, epidermis. So you can see my orange color lines. So this whole region is your superficial burns. The commonest is sunburn. Yes. So it is the superficial layer. This means it is not much serious. There will not be any blister. It will not be moist. It will not be moist. The surface will always remain dry. So if it is not moist, there is no blisters. Okay, edema will negligibly present. I would say it will not be that much. And obvious being there will be a bit redness. Yes, and it will heal without any scar in 2 to 3 days. So the takeaway point from this is it is an epidermal burn. It is red and erythematous. Yes, no blisters, dry, and heals without scar. So these are the points which are supposed to be understood, right, from this slide. Next one is superficial partial thickness burns. Okay, so superficial partial thickness means if this is your skin, this is your epidermis, and then we have a papillary dermis and reticular dermis. Okay, so epidermis, capillary dermis, and reticular dermis. Yes. So in this types of burn, again I will denote it with orange color. The whole epidermis and papillary dermis is involved. So now if the dermis is there, this means it is a type of, we have moved from the superficial till we are going into a deeper region. So this means it is epidermis, papillary dermis. Obvious, there will be blisters. It will be red color. If there are blisters, it would be moist. Edema will be moderate. That was 2 to 3 days, 7 to 10 days, and minimal scarring. This is the key points which we need to take from this slide. Okay, clear about this? Now moving on towards your partial, deep partial thickness burns. Yes, very important burns. Superficial partial were till papillary dermis. This has now till reticular dermis. You can see my lines moving downwards. So this has covered the whole epidermis and dermis region. So it would be obviously wet papillary dermis, reticular dermis, and one of the most important question is marked edema. If there is edema, this means it is till the dermis level. There is water loss. Deep pressure is though intact. It will take 3 to 5 weeks. That was supposed to take somewhere around 7 to 10 days, and it will obviously will heal with scar, hypertrophic or keloid scars. Clear? Now moving ahead with full thickness burns. Full thickness burns are nothing but your whole subcutaneous part. So here I would be drawing one more layer in a red line. No, not in a red, but in a black. Yes. So for example, this is your subcutaneous part. Subcutaneous region. Yes. So your burns will go till this region, which is much more serious. Yes. Okay. Epidermis, papillary dermis, reticular dermis, part of subcutaneous tissue. Part, we say it like this. Obvious being, it will be hard with an ischial formation, dry, leather, and rigid, and it will not heal by itself. We will require a skin grafting procedure in this. Clear? Uh, so we have completed with the full thickness burns. Now we are moving on towards our subdermal burns. This means all the layers below the subdermis, our bones, yes, vessels are being involved, muscles, bones, necrosis is there, and we required a surgical management in this. So, moving on, quickly revising it with our Types of burn. Superficial burn is epidermis, clear. Superficial partial thickness is epidermis, pus, papillary dermis. Deep partial is epidermis plus papillary dermis plus reticular dermis. Full thickness is epidermis plus papillary dermis plus reticular dermis plus part of subcutaneous tissue. And subdermal burns is your involving of your muscles, bones, which causes necrosis. So this is your subdermal burns. Marked edema is the hallmark feature of superficial or deep. It is deep partial thickness burns. Blisters कहाँ से आते हैं? Superficial partial thickness burns. Yes, so these are superficial partial thickness burns, deep partial thickness burns, and full thickness or subdermal burns. Clear? So, moving on with the whiteboards. Yes, I would like to revise it again. With the layers of the skin. Epidermis. Papillary dermis. Reticular dermis and subcutaneous tissue. So, if this is your epidermis, papillary dermis, reticular dermis, and subcutaneous tissue. Yes, I will mark on. Okay, so superficial burns are obviously involving epidermis. 1. This is 2, that is superficial partial thickness burns. This is 3. Yes, this is 4, and the region, if it involves everything, this is 5. So 1 is your superficial partial thickness burns. 2 is your 1 is your superficial burns. 2 is your superficial partial thickness burns. 3 is your deep partial thickness burn. 4 is your full thickness burns, and 5 is your subdermal burns. Clear? So with this, if you have any doubts, please let me know. Yes, and every burn will thermal burn can have an inhalation injury. So in next lecture we would be seeing about electrical burns, okay, and a video on how do we generally classify the burns. Okay, so this, I hope this has been meaningful to you. You have understood the concept. You have understood the concept of burns. Okay, in case of any doubts, please let me know. I would be more than happy to solve your doubts so that your basic concepts of burns remain solved. Okay, thank you very much. Thank you. If you have any doubts, please ask me. Thank you. You can drop in comment section or you can mail me at drparthtrivedi@live.com.